Why is vitamin D important, right? We talk about it all the time. Why is it important? Builds strong bones, helps the body absorb calcium, helps your immune system, critical to the immune system. And we're learning more about this, with this coronavirus pandemic that we've been through and still going through. Hi, everyone. Dr. Partha Nandi here. Welcome back. I've been away for a week. Happy to be back and wanted to share live with you. And, I was talking to some of my patients and thought this would be a good topic. Nutritional deficiencies. Lots of people. I had a lady that came in to our office and had literally a bag of 20 supplements for her nutritional deficiencies. And I thought it would be interesting to talk about common nutritional deficiencies and what do you do about them. So what I mean is the things that your body needs that you're deficient in, and what can you do about it. So today we're going to talk about some interesting stuff: vitamins and minerals, the American diet. We'll talk about iron. We'll talk about vitamin D. Lots of people hear about it. We'll talk about calcium. We'll talk about vitamin B12. We'll talk about magnesium and why they're important. We're going to talk about, listen, should we just get it from your food or should we get it from supplements like this young lady had? So, and what's the consequence of being nutritionally deficient, right? So, hey, where people say, oh, I'm nutritionally deficient, but what does that mean? How does that help or hurt me? So we'll talk about that too, what the consequences are, why we need certain key nutrients. Thanks for joining me today. It is a beautiful Tuesday here, and hopefully you're having a good day. Thanks for taking the time. So we'll talk about first vitamins and minerals. We talk about micronutrients. So what that means is those are the nutrients that, we're not talking about a big hunk of meat or, big piece of lettuce. They're the micronutrients in the food that helps you to really live a great life and be healthy. And they're the building blocks for great health. So important for vital development, to prevent disease and help to fight disease as well. So people only need small amounts. That's what they call micronutrients, right? So you don't need enormous amounts of these nutrients to be able to make a difference. And when you don't have them, you have serious consequences. Like what? For example, people can have serious birth defects. You may have problems with thinking, and sometimes you get this fog in your brain saying, "Listen, I can't think properly. I can't understand, and process quickly." It may be because of the lack of essential nutrients. Also, looking at productivity, that you're not as productive as you want to. So, micronutrients and having problems with that nutrition can make a huge impact on maternal health, infant. So kids, when women are pregnant and delivering babies, that's super important for them too. Micronutrients often are not produced in the body and we must get them from the diet, right? And so micronutrients often not produced in the body and it must be derived from the diet. Now the exception can be vitamin D. Now the federal government's guidelines. So if you ever read the labels, it says, these are the guidelines Americans call, right? For adults to eat about 2 to 3 cups of vegetables a day. We talk about all the time, eat vegetables. And research showed that most Americans, 90% of us, do not get what the daily guidelines recommended by the federal government. And then preliminary studies, 2019, showed that inadequate, not having enough fruits and vegetables can account for millions of deaths from what? Heart attacks, strokes. So it's not just a scientific experiment. You know that when you don't have those guidelines and you don't follow those guidelines, it can lead to severe decrease in your health. So typical American diet, I don't have to tell you, what does it consist of? Packaged foods, processed foods, red meat, high in saturated fats, salty snacks, all that stuff that people eat every day. And now the football season is coming. I love football, but I don't often love the stuff that comes with football, which is all the bad foods, right? And this can, when you eat those kinds of foods, you get the micronutrient deficiency. And this is how it happens. And it creeps up on you because you're like, it's all right. I'm going to eat a little bit of this, a little bit of that, and then pretty soon that makes up your diet. So very, very important. Hello to all you guys watching. Please let us know and listening too. Let us know where you're joining us from. As Laura, thank you from Farmington Hills. Bose from Lagos, Nigeria. Awesome place. And then Christine Solomon, thank you for joining us in Port St. Lucie, Florida. Gazy Brook from Maryland. And Gulfport, Mississippi. Jolene Stroud, thank you for joining us. Let us know if you have any questions. Hey, put them our way and we'll try to answer them for you. Let's talk about some very common nutritional deficiencies, right? Everybody knows about iron, right? Iron's super important. What's it important for? Motor and cognitive development. And red blood cells, the stuff that give you the energy, right? And you need that. And you need those red blood cells to carry the oxygen throughout the body. Not having enough of that will be detrimental. Remember, and red blood cells rely on what? Iron stores. So iron deficiency, leading cause of low red blood cell count, low hemoglobin, or anemia. Now, when you get that, for my practice, we check for if your iron levels are low, and if they are, then we have to be able to figure out why you're low and then replace them. Pregnancy, for example, can cause cause iron deficiency anemia because during pregnancy the volume of blood increases, and so does the amount of iron that's needed. So a woman's body uses iron to make more blood to give oxygen to the baby. Makes sense, right? If she doesn't have enough iron stores, right? If you're not getting enough iron, then you're not going to get enough of that blood. And so you could develop iron deficiency anemia. If you're low on iron, guess what? You could be tired and could be fatigued. This is why it's really important to know if you're taking enough iron. Other symptoms of iron deficiency anemia can include dizziness, headache. You can have sensitivity to cold, right? You feel cold, paleness in the skin and under the eyelids, and weakness. And all those can happen from having low iron levels. You can also have unusual, weird cravings, such as people want to. You ever see people like suck on ice or really want to eat ice? Can be a sign of low iron. People also for unusual cravings for dirt, for example. So remember that iron's super important. Where do you get iron? Right, food sources: beef, turkey, chicken, hard-boiled egg. Remember, if I say beef, it doesn't mean you go out there and have a porterhouse, right? You can have lean cuts of beef, lean cuts of turkey, lean cuts of chicken. Hard-boiled eggs are great. My boys have them. We often, it's a go-to for us. We have, hard-boiled eggs sitting in the fridge, and you pop them and you take them, and I think that's a great source of nutrition. And here, it's a great source of iron. Now, plant-based iron sources are very important as well, right? Remember that. So those of you who are watching, Tammy Esteves, hello. Julie Rogers just had an iron infusion. Tiffany Nostrand, hello. And Suzanne Flores, absolutely. And so, listen, very, very important that plant sources also are important. Iron absorption rates from plant sources a little lower than animal sources, right? But you can still get them. I love beans. I don't know if you guys do. Lentils, grains. We eat lentils every day. We eat dal every day. Anybody who's Indian who's watching know what dal is, right? Dal, spinach, whole grain cereals often fortified with iron. So it doesn't mean that you have to always have. There's this misnomer: if you're not having meat, you're not going to get enough iron. Not always true. So listen, you can have. I'm not saying you have to be vegetarian or vegan, but if you have lean cuts of beef, lean cuts of chicken, can also do the trick. Also, try eating a vitamin C rich food or beverage. You're asking why? Why is that? Why, Dr. Nandi? Because this vitamin C can increase the absorption of iron from foods. Important tip. So, it can help you to be able to absorb iron better. Now, if you feel unusually weak or tired, remember, talk to your doctor. Don't try to self-diagnose that. Well, I think I have this or this. Your doctor may test you, see what your iron levels are. Simple blood test. You do a blood test. They check iron saturation. They check something called ferritin. They can check your iron stores and then figure out, hey, are you iron deficient? So you don't have to guess this anymore, right? So really, really important. And then if you need supplementation, you can. Recommended daily allowance, right? That's kind of the recommendation from the government and nutritional boards. For elemental iron, depends on the person's age and sex. Adult men, 8 milligrams of iron per day. Adult women up to age 50 need 18 milligrams per day. If they're pregnant, 27 milligrams. We talked about increased need during pregnancy, right? And if they're lactating, they need 9 milligrams. Now, adult women older than 50 need 8 milligrams, very similar to what? Men. Now, people consuming their iron from plant sources need 1.8 times the recommended amount for their age group. And the reason why, a little bit less, slower absorption. So, excellent. People are writing all kinds of great stuff here. People like beets. People love homegrown Caribbean spinach. Excellent. Organic with rice. That sounds yummy. So, very, very important. Now we're moving from iron to what? Vitamin D, right? All of you, raise your hands. If you've heard of vitamin D, why is vitamin D important, right? We talk about it all the time. Why is it important? Builds strong bones, helps the body absorb calcium, helps your immune system, critical to the immune system. We're learning more about this, with this coronavirus pandemic that we've been through and still going through. Vitamin D is super important for the immune system and to resist bacteria and viruses. Also required for muscle and nerve functions. Too little vitamin D, and a lot of us here in Michigan have vitamin D deficiency. Too little vitamin D can result in soft bones in children, right? A condition called rickets, and fragile, misshapen bones in adults called osteomalacia, big word. Vitamin D deficiency is especially common, right, as we get older, since few foods are naturally rich in it. And so the body makes vitamin D. How does it make it? Right? We were talking about in the beginning that most micronutrients, right, are not produced in the body, but must be derived from diet now, except for vitamin D. And so vitamin D, how does your body make it? Makes it from sunlight, right? And getting enough sunlight for our skin really to convert to vitamin D may be easier in summer months, obviously, because places like here in Michigan, the days are truncated, the days are shorter. And so too much sun also is not great for you. So sunlight exposure needs to be limited to avoid the risk of skin cancer. You got to play that little bit of a balancing game. But vitamin D is super important for your health. Excellent. And then you have signs of deficiency that include, how can you tell when you have vitamin D deficiency, right? Fatigue, bone pain, mood changes, muscle aches, weakness. So you get so remember, we just talked about iron deficiency, some similar stuff, right? So if you have this, talk to your doctor. Don't try to diagnose yourself. Remember, they can test your vitamin D level and you can really get to the bottom of it. But signs of deficiency include fatigue, bone pain, mood changes, muscle aches, weakness, all of it. So very, very important. And Danita Gabriel, how are you? Asked about vitamin B12. We're getting to it. We're going to talk about vitamin B12 in very, 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 very soon. Food sources, right, for vitamin D. Few foods are naturally rich in vitamin D3. Best sources are the flesh of fatty fishes, like salmon, fish liver oils as well. Smaller amounts found in egg yolks, cheese, and beef liver. So those of you who love that beef liver, maybe a good source. Listen, I'm not a hater of beef liver, but not my favorite. I'll tell you that. So get some sun, right? Moving on. So certain mushrooms also contain some vitamin D2. Some commercially sold mushrooms have also higher amounts of D2 due to really been intentionally exposed to high amounts of ultraviolet light. And vitamin D fortified, you get foods like milk, yogurt, some orange juice, if you check the label, has it too, and some breakfast cereals. You need, in my opinion, you need a mixture of both foods and supplements to get the vitamin D your body requires. What about the recommended amount, right? This is important to understand. A recommended amount to be able to function. So 400 international units for children up to 12 months. 600 international units for ages 1 through 70, and 800 international units for those who are over 70. So again, 400 international units for kids up to age 12 months, 600 international units for people aged 1 to 70, over 7,800 international units. So vitamin D. And you guys are all watching, appreciate it, and all the questions. I love it. And Loretta asked what kind of store-bought vitamins are good. I'll get to it right now. Well, not right now. In a few minutes, talk about why I'm doing this live, and it's why I'm passionate about it, because so many patients ask the same question: what should I be getting? And sometimes you don't get good answers because there's always a lack of good supplements out there. So we'll talk about that. What about our next micronutrient, calcium? A lot of us talk about calcium. A lot of us hear our doctors talk about it. Why is calcium so important? Helps keep our bones strong. Also key for your muscles. Help control muscle and nerve functions and regulate our heartbeat. Very important. Calcium is incredibly important for your heart. Also, with potassium and magnesium, it may even help to prevent or decrease the incidence of high blood pressure. As estrogen drops, a woman's ability to absorb calcium goes down. Teenagers, older adults, and individuals who follow their eating styles are limited and avoid dairy are also at high risk for calcium deficiency. It doesn't mean that you always have to have dairy, but those who are avoiding dairy are a little bit higher risk for this calcium deficiency. Over time, calcium deficiency can result in weakened bones, fractures, even abnormal heart rhythms. This is serious stuff. So you got to really watch and understand that. You may not even know that you're not taking enough of the calcium. So what are some sources, right? Very, very important to know. What are some sources? Dairy is an excellent source. Cow's milk, fortified soy, almond milk, yogurt, and cheese. Some types of cereal. Soy milk, you can get it from tofu, orange juice, also fortified with calcium. Maybe surprising, certain dark green vegetables. And Tammy's talking about that, right? So kale is one of them, right? Dark green vegetables, kale, and broccoli. Our kids love broccoli, and we always tell them, we love our broccoli almost every day. So another source that people may not know about. So salmon, we talked about canned salmon, dark green vegetables like kale and broccoli. Remember, you need vitamin D for your body to absorb calcium. So it's really important to know. Really important to know that. Because we say, I'm not sure why my calcium is not working. Because if you're deficient in vitamin D, then you may not be getting the absorption of calcium. Most adults need 1,000 milligrams per day, but ages over 50 need up to 1,200 milligrams. So that's calcium. What about vitamin B12? Somebody asked about vitamin B12. Vitamin B12 is an important nutrient, and it's required for forming red blood cells and to maintain the health of nerve cells. Very important. We learned in medical school, right? If somebody's having problems with cognitive thinking, it's important to know if you've got the right amount of vitamin B12, also called cyanocobalamin. So vitamin B12 is very, very important. We get progressively less efficient in absorbing it as we get older. So especially those who are mature adults, super important for them to know that. Vegans and vegetarians, higher risk of deficiency since plants don't contain the vitamin. Very important. So it's okay to be a vegan or vegetarian. Remember, important to know that you're at higher risk of deficiency. What are some signs of deficiency of vitamin B12? It's not always, apparent, but fatigue from anemia. You can have numbness in hands, numbness in your legs and your feet, and you may have trouble with balancing and walking, trouble, with even doing some of those things that you think, be pretty simple, right? Walking seems pretty simple. Your memory can also suffer. Deficiency can also result in a kind of an unusual symptom, sore tongue, and sometimes can be associated with depression. People who are vegan or suffer from intestinal issues that result in problems are particularly at risk for vitamin B12 deficiency. Very important to know that. So food sources, right? Food sources, vitamin B12 found abundantly, meaning very, very readily in animal-based foods. Poultry, right, like chicken, fish. I love fish. We had salmon yesterday, and love that. So you can get it from fish, milk, and yogurt. Now, if you prefer plant-based option, you can try fortified non-dairy milks and cereals too. So you can get it. Doesn't mean that you have to be, if you're vegetarian, you just have to suffer and say, well, I'm just going to be deficient. No, there are solutions out there as well if you're doing that. So that's vitamin B12, very, very important micronutrient. Moving on to magnesium. I'm sure a lot of you have heard about magnesium, right? Magnesium, key mineral in your body. Many people are deficient. Close to 70% of the U.S. population under 71, over 80% of folks over 70 consume less than the required amount of magnesium. Startling, right? It's very, very important. Magnesium is a key player in digestion, in the health of your bones, sleep, mental health, and cardiac health. So super important to know that. Its deficiency of magnesium can cause lots of health issues such as osteoporosis, right? We talked about those bones, heart disease, diabetes, and even kidney damage. So very critical nutrients. Deficiency may be caused by disease, can be caused by drug use, your digestive system, your gut. I'm talking about the gut for a while. If your gut's not working well, it can also cause those problems. Or inadequate magnesium intake, right? Symptoms, super important to know that. Abnormal heart rhythm, right? You have palpitations, you feel like your heart's not beating correctly. Have to know if your magnesium level is appropriate. Symptoms can also be from muscle cramps, restless leg syndrome, fatigue, and then migraines. So kind of a variety, a little different than the other micronutrients we talked about. And then, hey, listen, Yasmina, hello, how are you doing? Susanna Flores, so awesome stuff. Keep the questions coming, keep the comments coming, and if you like this, hey, please share this with your audience. Give us some hearts, some likes. Love all that stuff, right? It helps us, keeps us going. We'd love to share good information instead of just talking about crazy stuff that people love to watch. This is also very important. We can help to spread good news and good information so we can uplift the health of folks. That's what Health Heroes do. So we talked about migraines and we talked about how magnesium can cause that. Now, more subtly, long-term symptoms that you may not notice include insulin resistance and high blood pressure. Get that. And you wouldn't think about that from a micronutrient deficiency. Food sources, whole grains, really important to have that. Nuts. I love nuts. Remember, you can have handfuls of them. You don't have to have a pound of them because nuts can have a lot of fat. So remember, in moderation. Dark chocolate's an important source, as well as dark green leafy vegetables. So important. The RDA, the recommended daily allowance, men 19 and above ranges between 400 to 420 milligrams per day. Women over 19 between 310 and 320 milligrams. So important to know what the RDA is. Now, when you're looking at these nutrients, so why am I talking about them? I told you in the beginning of my life is that people come in with boxes of stuff, and they're not really sure what's going on and what they should take. So I decided to really look into it, right? Should we all be taking supplements, right? Should we be taking supplements instead of food? No. Supplements are not intended to replace food. Very important to understand that. Not intended to replace foods. They cannot replicate all the nutrients and benefits of whole foods, like eating fresh fruits and vegetables, right? Whole foods, to me, offer three main benefits over supplements. Number one is better nutrition. When foods are complex, when they contain a bunch of nutrients together, it's better for you. Also, remember, essential fiber that's in whole foods, super important, like whole grains, fruits, veggies, legumes, right? We talk about legumes. And they provide the dietary fiber. And dietary fiber can, for instance, right, reduce the risk of diabetes type 2, help to be associated with decreased colorectal cancer, decreased stroke, decreased heart disease, all this stuff. I'll tell you, Dr. Nandi Charities, two of the biggest initiatives we have is to prevent colon cancer, prevent stroke. So, hey, you know what? Essential fiber does both of those. And then protective substances whole foods have, right? Whole foods contain chemicals that promote health, such as antioxidants, for example, and substances that slow down the natural process leading to cell damage. So important there. But who needs supplements, right? So the question is, wait a minute, who needs it? If you're doing everything you're supposed to, healthy adult, eats a variety of fruits and vegetables like you're supposed to, and you're doing everything well, you probably don't need supplements. But most people are not doing that, right? Most people are really, we talked about the majority of people are not getting the vegetables and fruits that you need. So supplements or fortified foods can be appropriate for you if you are, for example, if you're over 50, if you're pregnant, trying to get pregnant, if you have, for example, not a great appetite, have trouble getting nutritious foods, right? When you're having that trouble, you may need to be able to get supplements to be able to help you. And then you're following a diet that's exclusionary, meaning a special diet that can help you in certain respects, but you're excluding food so you can be nutritionally deficient. Have a medical condition that affects how your body digests nutrients. For example, if you have diarrhea that's chronic, that happens all the time on a regular basis. Food allergies, food intolerance, right? Or a disease of the liver, the gallbladder, intestines, or pancreas. Very important. Why are those important? Because they help to absorb and digest food, right? To break it down, right? You need your pancreas, you need your gallbladder, you need your intestine to break down food so they get absorbed. When you're not doing that well, you may need supplements as well. So if you've had surgery on your digestive tract, you may need supplements. So, whenever people ask me all the time, what's the best that's out there? And there are some good ones, but they leave some to be desired. So I decided to go on a hunt and say, what can we give to people that are health heroes, people that look and see, what can we give that's high in quality, give you great micronutrients. So we've developed our own line of supplements coming soon. I wanted to concentrate on big solutions first. So essential multivitamins for men and women, super greens, because so many people are not getting their greens. So I want to talk about super greens. And then in this day and age, immune health is so critical. It's always been critical, but especially now. So we'll talk about immune health and mood support. We'll start off with that. Now, if you're at any of my Health Hero pharmacies, the 3 locations in the Metro Detroit area, we're in Rochester Hills, we're in Troy, and we're also in Rochester Hills, in Rochester, and in Troy, Michigan. If you're at any one of those, if you look up healthheropharmacy.com, we'll have a full line of supplements coming probably mid-September. But online, we'll concentrate on the essential multivitamins. We want to get a good source of multivitamins for the everyday folks. Then also talking about, I want to make sure the immune health is really affected. And in greens, we believe in having fruits and vegetables, but if you're not having the opportunity to do that, then super greens are going to be important for you. But we'll talk about this in more detail. But I really found it was difficult to be able to recommend to anybody, hey, you know what, that this supplement line's great, or you should take these or not. I wanted to be able to get good products that are made so that people can get the nutrition in a way that they know it's good quality. They know that they're not being told a lie, and so we'll source it appropriately. But again, not for everybody, but for those who need it, it'll be essential. So again, today, what did we talk about, right? We talked about micronutrients. We talked about the fact that micronutrients can be essential for your health, right? And all the nutrients you need you may not be getting with your diet. So sometimes you may need help with the supplements. We talked about very important micronutrients today, and if you're listening, iron, super important. Get red blood cells, carrying your oxygen. We talked about vitamin D, very important for your bones, right? Along with calcium, can be super important for your health. Vitamin B12. We talked about magnesium, and we talked about really, do we always need to be getting our nutrients through supplements? And the answer is no. Whole foods, getting your foods to your nutrition is going to be critically important, right? So, we'll talk a little bit more about the line of supplements that are coming up. If you're at one of the Healthy Row pharmacies, again at Troy, Rochester Hills, we'll get all those in the middle of September. But online, we'll be able to give you some links so you can get that. But don't try to guess and say, hey, you know what? I think I'm nutritionally deficient. Remember, talk to your clinician, talk to your healthcare provider. They can do blood testing and really find out, can really specify what it is that you're deficient in. So you can then be armed with information and be very specific in what you're dealing with. So again, hey, thanks so much for joining us. I appreciate it. Remember, make healthy living a part of every day. Make make nutrition, make getting your body the right fuel a huge priority in your life. Make having a purposeful life with your community and your family. You can hear my family in the background. Make that an important part of your life, and that's how we all succeed together. Thank you for joining me today. Again, join me next Tuesday. We'll have another live for you. We'll talk about, I think topics that are important for your health and your family's health. Namaste, and I'll see you very, very soon. Thank you for joining me. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.